Hello everyone, my name is Anthony Carbajal. I'm 26 years old and recently I was diagnosed with ALS.
As it turns out, I have ALS, Lou Gehrig's disease.
Gleason was diagnosed with ALS, Lou Gehrig's disease.
Not knowing enough about ALS, being a baseball player, I know Lou Gehrig very well. I knew the trials and tribulations he went through, but at the same time, Lou Gehrig's disease, ALS, I didn't really know what it did. I didn't know the ramifications.
Commonly known as Lou Gehrig's disease, and for someone living with ALS, the disease is fatal. For loved ones, it affects every part of their lives.
Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a neurodegenerative disease that affects nerve cells in the brain and the spinal cord. When people have ALS, the motor neurons begin to die, which makes the brain unable to start or control the muscle function around the body.
About 5 to 10% of all ALS cases seem to be familial. It is believed that in the cases of familial ALS that the inheritance pattern is most likely autosomal dominant. A family member with FALS has a 50% chance of passing the mutation on to his or her children.
ALS is a progressive disease, so the symptoms are different depending on the progress. Early symptoms of ALS can be muscle weakness, tripping, slurred speech, muscle cramps, and twitches. In later stages, some symptoms can be impairment of the use of the arms and legs, thick speech and difficulty in projecting the voice, shortness of breath, and difficulty in breathing and swallowing. A person with ALS can eventually become paralyzed and lose all control of muscle function.
There is no cure for ALS at the moment, but there are multiple clinical trials that are going on and have been completed to help the disease become more clear. At Northwestern, they are currently recruiting people for an FALS clinical trial so that there can be an improved diagnosis and develop effective treatments that help get rid of symptoms of ALS and possibly delay or prevent the disease onset in individuals at risk for the developing familial ALS.
In gene C9orf72, which is the gene affected for 25 to 45% of all familial ALS, there is up to thousands of repetitions of 6 nucleotides, which would be a frameshift insertion. The protein that is affected is one that is produced in many regions of the brain and is found in many tissues and at tips of neurons, but the function is not yet known. However, given that it is found in the brain tissues and neurons, it could affect the functions of muscles if produced too many times and when not needed. In gene SOD1, which is affected in 10% of FALS, there is a 2 base pair deletion at codon 126, which codes for a protein that affects smooth muscle relaxant activities. When that protein is not produced, then the brain cannot regulate and control muscles properly.
About 20% of people with ALS live 5 years or more, and up to 10% will survive more than 10 years, and 5% will live 20 years. The quality of life for a person living with ALS is low because of the loss of function and paralysis of the body.
Approximately 5,600 people in the U.S. are diagnosed with ALS each year. The incidence of ALS is 2 per 100,000 people, and it is estimated that as many as 30,000 Americans may have the disease at any given time. It is estimated that ALS is responsible for nearly 2 deaths per 100,000 population annually. 80% of all ALS patients live between 40 and 70 years old. ALS occurs throughout the world with no racial, ethnic, or socioeconomic boundaries. Some famous people with ALS are Lou Gehrig and Dr. Stephen Hawking and Jim Catfish Hunter.
Alright, JT here. I am accepting the ALS Ice Bucket Challenge.
ALS Ice Bucket Challenge.
Ice now.
Thank you, Ryan Seacrest and T. Swizzy, for the challenge. Accepted.
Oh wait, that's not ice. That's $10,000 in cash, which I am donating to the ALS Foundation because, let's face it, ice is going to melt, but this money is going to actually help people.